Mark, believe it or not, 2 years since the official start of the pandemic. One thing is clear. The COVID crisis further exposed the painful divide when it comes to medical care in the U.S.
Yes, Dr. Simone Wilds is an infectious disease specialist at South Shore Health. We always like to see you, doctor. Thank you so much for joining us on a Friday. Dr. Wilds, you recently wrote a pretty powerful essay about this very issue. You share a story about a phone call that you got from a friend during the vaccine rollout. We'd love to have you share that with us.
Yes, Maria, the impetus for this story, which really pushed me to write this article was, I got a call from one of my friends telling me that she had her elderly grandmother who needed to be vaccinated, but she was scared about taking her to the mass vac site. And she also had a lot of underlying conditions that made her really worried. And she thought I had all the answers, but unfortunately I did not. And so it really made me think that, we need to do more. And yes, things have changed, but it was really very painful at the start of the pandemic when we didn't have all the programs in place.
Right. I got to talk to you about this because we know that access to care, definitely a struggle for many families of color. You've been meeting, we know, with community groups about this. What are you hearing about it all, about closing that gap?
Jessica, I continue to meet with these different groups because the work continues. I really don't want us to think that because the pandemic is done, that, we need not to get into these communities. And what I keep hearing over and over again is, access is still an issue. I've found that there's individuals that continue to have no access or limited access. And then on the other side, we have those who have access, but it's not timely access, which really points us in the direction that we have more work to do. Right. Now that we're out of the pandemic, we still have to continue working.
We do have to continue working, but doctor, this is not a new problem. It's been brought into sharper focus by the pandemic. So what can be done to address it? In your expert opinion, what's the first step?
Maria, that's a really difficult question. And you're right, this problem has been with us for a while. And I think really for me, it's a multifactorial approach. I think we have to look at trust. We have to look at access, and we have to look at information. And just a quick example, during the pandemic, telehealth, that was something that was widely used, but it was not necessarily available to all communities. I think that's one of the issues that we can work on. And I think the key thing that I want to leave is we have to be intentional about the care that we give to those in these vulnerable communities. And we need to get a blueprint that can get that started.
Yeah, the access for sure. Dr. Simone Wilds, we appreciate your insight, your time as always.
Thanks, doctor. Stay well.